The conference room at Mercy General Hospital smelled like burnt coffee and old pride. 6:17 on a Monday morning, and the trauma team was already assembled. 10 men in surgical scrubs, most with decades of experience etched into the lines around their eyes. They stood in loose clusters, trading weekend stories and case notes, their voices carrying the easy confidence of surgeons who'd seen everything. Then she walked in. Eleanor Kincaid was 5'2" in her sneakers. The hospital issued scrubs hung on her small frame like she'd borrowed them from an older brother. Her red-brown hair was pulled back in a simple ponytail, and her green eyes took in the room with a quick, assessing sweep that none of the men noticed. She looked young, startlingly young, like someone who should be checking IDs at a college bar, not making life or death decisions in a level 1 trauma center. The conversations died. 10 pairs of eyes tracked her movement to the empty chair at the foot of the conference table. Dr. Trevor Whitmore broke the silence first. He was 38, Ivy League educated, with the kind of sharp features and sharper tongue that made residents nervous. "Gentlemen," he said, his voice dripping with amusement, "I believe we have a visitor. Miss, the volunteer coordinator's office is on the 3rd floor." Scattered chuckles rippled through the room. Elle set her coffee down carefully. "Dr. Eleanor Kincaid. I'm the new attending trauma surgeon." The silence that followed was worse than the laughter. Whitmore recovered first. "Doctor?" He drew the word out, savoring it. "You look like you just graduated high school." "Medical school, actually, 6 months ago." Her voice was quiet, controlled, matter-of-fact. 6 months. Whitmore glanced at the other surgeons, eyebrows raised. "What are you, 22? 23? 26? Fresh out of school and they throw you into level 1 trauma?" Another surgeon, Dr. Marcus Henley, shook his head. "Budget cuts must be worse than I thought." Elle pulled out the chair and sat. The metal legs scraped against the tile floor, the only sound in the room. Whitmore leaned back, arms crossed. "Says here in your file you were a nurse before medical school. Military nurse." He made it sound like an insult. "So basically a battlefield medic with a crash course in real medicine. 6 years. Navy fleet surgical teams. Iraq and Afghanistan." "How cute." Whitmore's smile didn't reach his eyes. "But nursing isn't doctoring, sweetheart. Even military nursing. You followed orders, handed instruments to the real surgeons. Maybe started an IV if they let you." Elle's jaw tightened fractionally. "I did 213 trauma saves as the lead surgical nurse in forward operating bases." "Under supervision, I'm sure." Whitmore spread his hands. "Look, I'm sure you were great at what you did. Combat nursing is important work, but this is different. This is real, independent medicine, life or death decisions. No one to hold your hand." The words hung in the air like smoke. Elle reached into her bag. Slowly, deliberately, she pulled out 3 items and placed them on the conference table. The overhead fluorescence caught the metal, making them gleam. A Navy Commendation Medal with a bronze V device for valor. A bronze star. A red, white, and blue ribbon, the Combat Action Ribbon. "Kandahar Province, 2020, she said quietly. 12 casualties from an IED strike. No surgeon available. I performed 4 thoracotomies, 6 laparotomies, and 11 major vessel repairs. In a tent, under indirect fire. All 12 survived." She stood up. The chair scraped again. "Helmand Province, 2021. Mass casualty event. 17 wounded. I triaged, intubated, operated for 14 straight hours. 16 survived." She picked up her coffee. "I've sutured arteries while the building shook from mortar impacts. I've done needle decompressions in the back of moving vehicles. I've held beating hearts in my hands and willed them to keep pumping." She walked to the door, paused, didn't turn around. "So no, Dr. Whitmore, I won't need anyone to hold my hand." The door closed behind her with a soft click. For a long moment, no one spoke. Then Whitmore laughed, a short, harsh sound. Well, that was entertaining. The emergency department radio crackled to life at 7:43. Mercy General, this is Rescue 1. We have a mass casualty incident. Multiple vehicle collision on Highway 70, eastbound at mile marker 47. Preliminary count, 9 vehicles involved, approximately 15 casualties. 4 critical inbound. ETA, 8 minutes. Repeat, 4 critical patients, 8 minutes. The overhead speakers echoed the message throughout the department. Trauma alert. All available personnel to the ER. Elle was in the physician's lounge, forcing down a granola bar she didn't taste. The announcement sent a jolt of adrenaline through her system, familiar, almost welcome. She was moving before the message finished, muscle memory from 6 years of combat medicine taking over. The ER transformed in seconds. Nurses appeared from hallways and break rooms. Residents scrambled to set up trauma bays. The controlled chaos of a level 1 center spinning up to receive multiple criticals. Dr. Whitmore strode into the center of it all like a general surveying troops. Listen up, 4 critical patients incoming. Dr. Henley, take Bay 1. Dr. Fisher, Bay 2. I'll take Bay 3. That's going to be the worst one, guaranteed. He turned, seemed to notice Elle for the first time. Dr. Kincaid, Bay 4. Minor wounds, probably just needs observation and discharge. Try not to screw it up. Elle's eyes narrowed fractionally. Bay 4 was separated from the main trauma area, basically a holding pen for the walking wounded. He was sidelining her, deliberately. Understood, she said. The first ambulance screamed into the bay at 7:51. EMT Jackson Pierce jumped out. Late 20s, former Marine based on the haircut and bearing. 47-year-old male, rear-ended at highway speed. Complained of severe chest pain initially, now says he feels okay. Vitals stable. BP 130/80, heart rate 82, SATs at 98%. Whitmore barely glanced at the patient. Walking wounded, Bay 4. Pierce caught Elle's eye as they wheeled the patient past. Something flickered in his expression. Recognition, maybe. He'd seen that look in her eyes before. Combat medics knew their own. Elle followed the gurney to Bay 4. The patient was conscious, alert, chatting nervously with the paramedic. I'm fine, really. Just shaken up. Didn't even hit my head or anything. Let's take a look anyway, sir. Elle's hands moved efficiently, professionally. Penlight checking pupils, fingers palpating the chest wall, feeling for deformities, crepitus. Any trouble breathing? No, I'm good. Like I said, Elle's fingers stopped. There, right side of the neck. Subtle, but present. Distended jugular vein. She moved her stethoscope. Right lung. Breath sounds present but diminished. Not absent, just less. Her mind raced. Not just anxiety. Not just bruised ribs. Sir, take a deep breath for me. He did. Winced slightly. Elle's eyes tracked his chest wall. Right side moving, but not quite right. Subtle tracheal deviation to the left. Her blood went cold. Tension pneumothorax. Early stage, still compensating, but deteriorating. She straightened. I need... A scream cut through the ER. Bay 3. Whitmore's patient. Elle's head snapped around. Through the gap in the curtains, she could see the monitor. Blood pressure dropping. 70/40, then 60/, palp. Whitmore's voice, sharp. Get me a chest x-ray. Now! Elle's patient shifted on the gurney. Doc, what's... His eyes widened. His hand went to his chest. Elle looked at the monitor. SATs dropping. 96, 94, 92. The tracheal deviation was more pronounced now. His jugular vein bulging. Tension pneumothorax. No longer early stage. Active. Progressing. Protocol said inform the attending. Get approval for invasive procedures. Follow the chain of command. Elle's mind flashed back. Afghanistan, 2019. A Marine Lance Corporal, same presentation. She'd followed protocol. called for the surgeon, waited. He died while she watched. 3 minutes, that's all it took. She'd promised herself, never again. Elle spun to the supply cart, grabbed a 14-gauge angiocatheter, betadine swab, gauze. Sir, I need you to stay very still. This is going to hurt, but it's going to save your life. Her fingers found the landmark. Second intercostal space, mid-clavicular line, right side. She'd done this drill hundreds of times. On dummies, on oranges, on casualties who were seconds from death. She cleaned the site, positioned the needle. On 3, 1, she pushed. The needle punctured skin, slid between ribs, into the pleural space. A hiss of pressurized air escaped. Not a whisper, a rush, like opening a can of soda that had been shaken. The patient gasped. His eyes went wide, but with relief, not pain. Elle watched the monitor, oxygen saturation climbing, 94, 96, 98. The jugular vein deflating, his color improving. 34 seconds, from decision to resolution. What the hell are you doing? Elle turned. Whitmore stood 3 feet away, face red, eyes blazing. Needle decompression, Kenshin pneumothorax. Did I authorize that procedure? The patient was, did I authorize it? His voice carried across the ER. Nurses stopped. Residents froze. You're a brand new attending who doesn't know her ass from her elbow, and you just performed an invasive procedure without consulting the supervising physician. Elle's voice stayed level. With respect, there wasn't time. Classic presentation, rapidly deteriorating. A monitor alarm shrieked. Bay 3, Whitmore's patient, the one he'd called the worst case, the one he'd kept for himself. Blood pressure 40 over palp, heart rate 160, oxygen saturation 78 and dropping. Whitmore spun, ran back to his bay. Elle looked at her patient, stable, comfortable, breathing easily. She should stay here, finish her case, follow protocol. But she could hear it, the sound of a trauma going bad. Whitmore's voice getting sharper, more desperate, ordering tests, calling for equipment, making all the wrong calls. Elle's feet moved before her brain caught up. She crossed the ER in 10 strides, shouldered through the curtain into Bay 3. The patient was a woman, mid-30s, barely conscious. Multiple lacerations, left chest wall bruised, distorted. Elle's eyes went to the monitor, then to the patient, then back. She saw it immediately, what Whitmore was missing. Hemothorax, Elle said. Massive. She needs a chest tube. Now. Whitmore whirled. Get out of my trauma bay. Look at her chest wall. Flail segment. Probable rib fractures with lacerated intercostal vessels. She's bleeding into her chest cavity every second. I said, get out! Elle didn't move. Her eyes stayed on the patient. Blood pressure dropping. 38 over palp. This woman was going to die. Elle made a decision. She grabbed the chest tube kit from the code cart, ripped it open. Dr. Kincaid, I'm ordering you. Elle's hands moved with absolute certainty. Betadine prep. Drape. Scalpel in hand. If you touch that patient, Elle made the incision. 5th intercostal space, mid-axillary line. Blunt dissection through the tissue planes. Her fingers felt the pop as she entered the pleural space. She grabbed the chest tube, 32 French, inserted it through the tract, advanced it posteriorly and superiorly, connected it to the drainage system. Blood poured out, dark, venous, 800 milliliters in the first 30 seconds, then another 400, then another. On the monitor, the blood pressure started to climb, 40 over palp, 50, 60, oxygen saturation rising, 82, 87, 91. The woman's eyes fluttered. She gasped. Her hand moved, weakly grasping at the rails. She was alive. Elle stepped back, Her hands were covered in blood. The front of her scrubs was sprayed with it. Whitmore stood frozen. His face had gone from red to white. You, he couldn't seem to form words. You had no authority. You assaulted my patient. No, the voice came from behind them, deep, gravelly, calm. Dr. Garrett Ashford stood in the entrance to the bay. 64 years old, gray hair, weathered face. Chief of Trauma Surgery, Army veteran, Desert Storm. She saved your patient. Ashford's eyes moved from the drainage system, still collecting blood, to the monitor showing improving vitals. That's a textbook chest tube placement for traumatic hemothorax. Response to treatment is immediate and dramatic. He looked at Whitmore. My office, now. Whitmore opened his mouth, closed it, walked out. Ashford's gaze settled on Elle. He studied her for a long moment, took in the blood on her scrubs, the absolute steadiness of her hands, the way she was already checking the tube placement, ensuring security, doing the follow-up work automatically. Fleet surgical team? He asked quietly. Yes, sir. FST-3 and FST-7. He nodded slowly. You've done this before. 57 times, sir, in combat. It shows. He glanced at the patient, who was now fully conscious, crying with relief. Good work, Dr. Kincaid. He left without another word. Elle stood in the blood-spattered bay, adrenaline starting to ebb. Around her, the ER continued its controlled chaos. 3 other critical patients being stabilized, the walking wounded being processed, life-saving medicine happening in every corner. This was supposed to be her first day, her fresh start, her chance to leave the war behind and practice medicine in peace. Instead, she just declared war on the entire trauma department. Dr. Ashford's office was quiet, too quiet, the kind of quiet that came before storm systems and bad news. Elle sat in the chair across from his desk, still in her bloody scrubs. She'd been summoned here directly from the ER. No time to change, no time to process. Ashford poured 2 cups of coffee from a pot that looked like it had been sitting since dawn, handed her one, sat down. Tell me about your father, he said. Elle blinked. Of all the things she'd expected, reprimand, termination, lecture, that wasn't on the list. Sir? Commander Thomas Kincaid, SEAL Team 5, your father. Ashford sipped his coffee. It's in your file, next of kin, deceased. Elle's throat tightened. He died in Fallujah, 2014. Operation Inherent Resolve. I know, Ashford set down his cup. I was at Al-Taqaddum Air Base when his team came through. 2007. Your father and his SEAL team saved a convoy that got ambushed en route Michigan. They heard the call, Marines in contact, taking casualties, and they went in. Weren't even their guys, just heard brothers in trouble and went anyway. He paused. I treated the survivors. One of them told me about a SEAL who ran into the kill zone 3 separate times. Pulled out 4 wounded Marines, just walked into the fire and pulled them out. Your father did that. Elle's vision blurred. She blinked hard. When I saw your name on the hire list, Ashford continued, I pulled your full military record, not just the official stuff. I called some people, former Navy surgeons, Fleet Marine Force corpsmen who served with you. He leaned forward. You know what they told me? Elle shook her head. They said you were the most competent trauma nurse they'd ever seen, that you had instincts they couldn't teach, that when everything went to hell, you were the one who stayed calm, who saw what needed to be done and did it. He picked up a sheet of paper from his desk. 213 documented saves, 11 Navy Commendation Medals, 1 Bronze Star, a recommendation for the Navy Cross that's still working its way through channels. He set the paper down. That needle decompression this morning, that was textbook tactical combat casualty care. I know because I taught it. Desert Storm, I was with the 274th Forward Surgical Team. We wrote some of those protocols. Elle found her voice. I just did what needed to be done, sir. I know, and that's the problem. Ashford's expression was sympathetic, but firm. Dr. Kincaid, L., you have more real-world trauma experience than half the surgeons in this department. But they don't see that. They see a woman who looks 22. They see former nurse on your resume, and they think you followed orders and handed instruments. They don't understand that military nursing, especially Fleet Marine Force nursing, is nothing like civilian nursing. I know, sir. So here's what's going to happen. Ashford finished his coffee. Whitmore is on probation. This incident gives me leverage. He's going to be very, very careful around you from now on. Yes, sir. But he's also going to be watching, looking for any excuse. And he's not alone. He stood. Elle did the same. You're going to have to prove yourself. Every single day. Every single case. Elle met his gaze. My father used to say that respect isn't given. It's earned. One decision at a time. Ashford smiled, a small, sad smile. He was right, and you've got his instincts. He walked her to the door. Now go change your scrubs. You're on night shift tonight. Elle stopped. Sir? Midnight to 0800. Whitmore requested it, said the new attending should get familiar with all shifts. Ashford's expression was grim. He's trying to bury you in the worst rotation. Alone. Minimal backup. Maximum chance for mistakes. Understood. Dr. Kincaid, he waited until she looked at him. Night shift in a level 1 center can be hell. If you need help, I won't, sir. Elle's voice was quiet but certain. I've worked alone before. Ashford studied her face, saw something there, something familiar from his own days in combat medicine. Yeah, he said finally, I bet you have. The hospital at night was a different creature. The fluorescent lights seemed harsher, the shadows longer, the quiet broken only by the beep of monitors and the soft shuffle of nurses changing shifts. Elle sat in the physician's lounge at 11:45. Night shift started in 15 minutes. She tried to sleep that afternoon and failed. Her mind kept replaying the morning, Whitmore's face, the blood, the rush of air from the needle decompression. The door opened. A nurse walked in, late 40s, solid build, gray-streaked hair pulled back in a tight bun. She stopped when she saw Elle. Dr. Kincaid? Yes? Caroline Hewitt, trauma nurse. She poured herself coffee, studied Elle with frank curiosity. Heard what you did this morning. Whitmore's having a meltdown about it. I'm sure. Good. Caroline's smile was fierce. That man needed taking down about 5 years ago. She sat down across from Elle. Army, 2 deployments. Iraq, 07 and 09. So I know what Fleet Marine Force looks like. You've got the look. Elle felt something unclench in her chest. Recognition. Validation. Thanks. Don't thank me yet. Night shift is brutal. We're understaffed, under-equipped, and you're going to be the only attending for 8 hours. Caroline's expression softened. But you've worked alone before, haven't you? Yes, ma'am. Don't ma'am me. We're the same rank here. She stood. Come on, let me show you where everything is. At 12:03, the radio crackled. Minor trauma. Handled. At 1:47, they handled a domestic violence assault. At 2:17, a car accident with minor injuries. And at 2:47, everything changed. Mercy General, this is Rescue 2. The EMT's voice was tight, professional, but with an undertone Elle recognized instantly, controlled fear. We have a level 1 trauma inbound, 21-year-old male, multiple gunshot wounds, chest, abdomen, left thigh, massive hemorrhage, blood pressure 60 over palpation, heart rate 158, GCS is 4, ETA is 6 minutes. Repeat, this is a level 1, 6 minutes out. Elle was already moving. Call anesthesia, call surgery, anyone available. Caroline grabbed the phone, dialed, listened, hung up. Anesthesia is at Community General on a consult. Surgery, she checked her watch. Dr. Whitmore is on call. Elle pulled out her phone, dialed Whitmore's number. It rang 4 times, then, "What?" His voice was thick, slurred. "Dr. Whitmore, we have a level 1 trauma incoming. Multiple GSWs. I need you here now." "Handle it yourself, you're the hotshot combat doc." A bitter laugh. "This is what you wanted, right? To prove you can do it alone?" "Doctor Whitmore, figure it out, sweetheart." The line went dead. Elle stared at her phone for 2 seconds. Then she moved. "Caroline, Trauma Bay 1, massive transfusion protocol. I need 10 units of O-negative blood, rapid infuser, 2 chest tube kits, thoracotomy tray, intubation equipment, full kit." Caroline's eyes widened. "You're going to?" "I'm going to do whatever it takes. Move." They moved. Elle prepped Trauma Bay 1 with practiced efficiency. The ambulance bay doors crashed open at 2:53. EMT Pierce and his partner wheeled in the gurney at a dead run. The patient was young, couldn't be more than 21, wearing a white t-shirt soaked completely red. His eyes were half open, his breathing shallow, gasping. 3 GSWs, Pierce reported, hands compressing the chest. Right hemithorax, left upper quadrant abdomen, left groin. Femoral bleed controlled with manual pressure. Lost consciousness 30 seconds ago. Pupils still reactive. Elle's hands were already moving. "Transfer on my count. 1, 2, 3. They moved him to the trauma bed. Caroline cut away his clothes with shears. The fabric fell away in blood-soaked strips. Elle did her primary survey in 15 seconds. Airway compromised, breathing inadequate, circulation, barely palpable carotid pulse. "He needs to be intubated." Caroline had the airway kit ready. Elle had done this 53 times in combat, without anesthesia backup, without respiratory therapy. Just her, a tube, and a patient seconds from death. Etomidate 20 milligrams. Rocuronium 100 milligrams. She drew the drugs herself, pushed them IV, waited 10 seconds for the patient to go completely limp. Position the laryngoscope. Visualize the vocal cords. Slid the endotracheal tube into place. 28 seconds from decision to secured airway. She inflated the cuff, connected the bag valve device, squeezed, watched the chest rise. Breath sounds. She listened with her stethoscope. Right side, diminished. Left side, present but decreased. The monitor showed oxygen saturation climbing. 78, 83, 87. "Chest X-ray," Elle ordered. The portable machine rolled up. Image taken. Appeared on the screen in seconds. Elle's blood went cold. Right hemothorax, massive. The entire right chest cavity was white, filled with blood. And the abdomen, free fluid visible even on the X-ray. This kid was bleeding to death from multiple sources. Fast exam. Elle grabbed the ultrasound probe. Ran it over his abdomen in the 4 standard windows. Positive in the left upper quadrant. Free fluid surrounding the spleen. Positive in the pelvis. More free fluid. He was bleeding into his abdomen. Badly. Elle straightened, looked at the monitor. Blood pressure 42 over palp. Heart rate 165. He needed an operating room. He needed a surgeon. He needed a miracle. She had none of those things. What she had was 6 years of forward surgical experience. 14 times performing emergency surgery when no one else was available. 213 saves. And a kid who would die if she hesitated. Elle looked at Caroline. "Prep for emergency thoracotomy and laparotomy." Caroline froze. "Here? In the ER? No time for the OR. He'll die in transport." Elle was already gloving. "I've done this before. I can do it again." "Dr. Kincaid, that's not a request." For a moment, Caroline just stared. Then something shifted in her expression. Recognition, maybe, or respect. She'd served in combat. She knew that look. Yes, ma'am. Caroline started pulling equipment. Elle looked at the clock. 2:58. She looked at the kid on the table, unconscious, dying. She made a decision she couldn't take back. The scalpel felt alive in her hand, cold steel, sharp enough to split skin with the lightest pressure. She positioned herself on the patient's right side, drew an imaginary line with her eyes, fifth intercostal space, mid-axillary line to anterior axillary line. Betadine. Caroline handed her the prep. Elle painted the entire right chest orange-brown. Draped the field. She put the scalpel to skin. Starting right anterolateral thoracotomy. The blade moved. One smooth motion. Through skin, subcutaneous tissue, muscle. Blood welled immediately. Elle worked fast. Electrocautery to control bleeding. Scissors to cut deeper. Her hands remembered this. Muscle memory from Helmand Province, from Kandahar, from dusty forward operating bases where she'd learned that hesitation meant death. She reached the intercostal muscles, cut through them, felt the sudden give as she entered the pleural space. Blood poured out, dark, venous. It flooded the field. Suction! Elle's voice was calm. Caroline handed her the Yankauer suction. Elle evacuated blood. 1 liter. 2. She grabbed the rib spreader, positioned it, started cranking. The ribs separated with a sound like green wood breaking. The patient's chest gaped open, a window into his dying body. Elle could see everything now. The lung collapsed and pale, the heart beating frantically, and the bleeding, a lacerated intercostal artery spurting with each heartbeat. Clamp! Caroline slapped it into her palm. Elle reached into the chest cavity and clamped the vessel. The spurting stopped. Tie! She ligated the artery, tied it off, cut the suture. The monitor beeped, blood pressure rising. 50 over palp, 55. He's responding, Pierce said. But Elle wasn't done. She looked at the abdomen. The kid's belly was distended, tight, filled with blood from the spleen injury. I need to go into the belly, now. She looked at Caroline. New instruments, laparotomy tray. Caroline moved fast. Elle made the abdominal incision, vertical midline, xiphoid to pubis, through skin, through fat, through fascia. The peritoneum opened. Blood erupted, fresh, red, arterial. It fountained up, soaking Elle's gown, spattering her face shield. Elle's hands plunged into the abdomen, found the spleen, or what was left of it. The organ was shredded, a grade 4 laceration, maybe grade 5. She packed the area with laparotomy pads, applied direct pressure. More blood, push 2 units, fast. Pierce hung the units, squeezed the rapid infuser. The monitors showed the heart rate slowing. 170, 160, 150. Blood pressure climbing. 60 over 40, 65 over 40. Elle looked at the shredded spleen beneath her hands. She could try to repair it, or she could do what needed to be done. Splenectomy. Remove the organ. Stop the bleeding. Save the life. I'm taking the spleen. She worked with brutal efficiency, mobilized the organ, divided the splenic artery and vein, tied everything off. The spleen came free, a dark purple mass of destroyed tissue. The bleeding slowed, then stopped. Elle packed the abdomen, closed the fascia temporarily with towel clips. Damage control. Keep the kid alive long enough to get him to the OR. She looked at the clock. 3:47. 49 minutes since the ambulance arrived. The monitor showed blood pressure 90 over 60, heart rate 120, oxygen saturation 93%. He was alive. Elle stepped back. Her gown was soaked through with blood. Her hands were shaking now, finally shaking after it was over. Get him to the OR, she said quietly. Call surgery. Tell them we have a patient post-damage control laparotomy and thoracotomy. Pierce was staring at her. Ma'am, that was... Elle pulled off her gloves. That was battlefield medicine. That's all. Caroline grabbed the phone. I've been nursing for 26 years. I've never seen anything like that. Elle walked to the sink, washed her hands. The water ran red, then pink, then clear. The door to the trauma bay opened. Dr. Garrett Ashford stood in the entrance. He was in street clothes, jeans, a button-down shirt. He'd been called from home. His eyes moved from Elle, blood-soaked, exhausted, to the patient being wheeled toward the elevators, to the trauma bay that looked like a battlefield surgical site. Caroline called me, he said quietly, told me you were doing an emergency thoracotomy and laparotomy in the ER, alone. Elle dried her hands. Yes, sir. How many times have you done that? In combat? 14 times, sir. This was number 15. Ashford walked into the bay, stopped at the instrument tray, looked at the clamps, the blood-streaked scissors, the sutures. What was the blood loss? Approximately 3,000 cubic centimeters. We transfused 8 units O negative. Prognosis? Elle met his eyes. If I'd waited for backup, he'd be dead. If I'd tried to transport him to OR, he'd be dead. This was the only option. Ashford nodded slowly. Will he survive? Yes, sir. He'll need more surgery, but he'll survive. For a long moment, Ashford just looked at her. Then he smiled. Not a big smile, just a small, tired curve of his mouth. Your father would be proud. Elle's throat tightened. She swallowed hard. Thank you, sir. Go home, shower, sleep. You're off for the next 48 hours. Sir, I'm scheduled. I'm rescheduling you. That's an order. He headed for the door, paused. And Dr. Kincaid, next time you save a life like that, try to leave some blood in the patient, not on the walls. He left. Elle stood alone in the bay. The fluorescent lights hummed. Somewhere down the hall, an IV pump beeped. She looked at her reflection in the darkened window, saw herself, blood-covered, exhausted, saw her father's eyes looking back. I'm still saving them, Dad, she whispered, just like you taught me. 3 days after the solo surgery, Elle stood in the ICU, looking at the kid she'd saved. His name was Marcus Webb, 21 years old, former high school basketball star. Wrong place, wrong time. 3 bullets that should have killed him. He was awake, intubated still, but awake. His eyes tracked her as she entered. Hey, Marcus. Elle checked his monitors. Everything looked good. Blood pressure, stable. No fever, healing appropriately. You're doing great. We're going to get that breathing tube out tomorrow, okay? He nodded weakly. You're lucky, very lucky. Elle paused. You're going to be fine. She left before he could try to communicate. Some conversations were too hard, even for combat veterans. That afternoon, the hospital admitted a new patient. VIP transport from the VA hospital. Cardiac case. Routine transfer for a higher level of care. Elle was assigned because she was available, because it was supposed to be simple. The patient's name was Marcus Brennan, Major General, United States Marine Corps, retired, age 68, acute coronary syndrome. Widowmaker, M.I., the kind that killed most people before they reached the hospital. Elle reviewed his chart in the hallway. Impressive medical history, multiple combat deployments, wounded twice, retired with full honors, living alone in Colorado Springs, collapsed at the VA during a routine checkup. She pushed open the door. The general was barely conscious, gray-faced, sweating. His eyes were half closed. The monitor showed ST segment elevation. General Brennan, I'm Dr. Kincaid. I'll be taking care of you. His eyes opened slightly, struggled to focus. His gaze drifted to her name tag. Elle didn't think anything of it. Patients often looked at name tags. But the general's eyes widened. His hand moved weakly, reaching toward her. Kincaid, he whispered. His voice was rough, barely audible. Eleanor? Kincaid? Elle froze. Yes, sir, do you? Tom Kincaid's daughter? The world tilted. Elle's professional composure cracked. You knew my father? The general's eyes closed. When they opened again, they were wet. Fallujah, 2014. Your father saved my life. Elle couldn't breathe, couldn't move. Sir, you need to stay calm. Your heart. I was trapped. Burning vehicle. IED. Each word cost him, his face twisted with pain. Your father ran into the fire, pulled me out, went back 3 more times. 4 Marines. He saved 4 of us. Elle's hands trembled. She gripped the edge of the bed. The building collapsed. Secondary IED. He was inside. The general's breathing was labored. Tears ran down his weathered face. I never got to thank him. Tried to find your family. Your mother moved. I've carried this debt 10 years. General Brennan, you don't owe us anything. No. The word was fierce despite his weakness. He was a hero, and I'm only alive because of him. The monitor alarmed, blood pressure dropping, heart rate becoming irregular. Elle's training took over. I need cardiology down here now, and prep the cath lab. We're going up. She looked at the general. His eyes were closing. General Brennan, Elle's voice was soft but commanding. My father saved your life. Now let me save it for him. His eyes opened, met hers. In them she saw recognition, understanding, hope. Yes, ma'am. The cardiac catheterization revealed catastrophic 3-vessel disease. The left anterior descending artery, 97% occluded. The right coronary artery, 92%. The left circumflex, 88%. Dr. James Reynolds, the cardiothoracic surgeon, stared at the images. He needs a triple bypass, but his ejection fraction is 28%. His heart is barely pumping. The mortality risk. What's his chance if we wait? Elle interrupted. Every hour increases mortality by 8%. If we wait 24 hours, he'll probably be dead. Then we operate now. Dr. Kincaid, he's 68 years old. He's in cardiogenic shock. He's a Marine. Elle's voice was quiet but intense. They're conditioned differently. Their physiology handles stress better. I've seen Marines survive injuries that would kill anyone else because they don't quit. Ever. Dr. Ashford appeared in the doorway. What's the debate? Reynolds explained. Ashford listened. Then he looked at Elle. What's your recommendation? Operate now. Accept the risk. Give him a chance. Based on what? Based on 6 years of seeing Marines refuse to die. Based on knowing this man has fought through worse. Based on... Elle stopped, swallowed. Based on owing him. My father saved his life. I won't let him die now because we were too cautious. Ashford was silent for a long moment. Then he turned to Reynolds. She's right. Marines are different. We operate. Reynolds nodded slowly. All right, but I want her in the OR. First assist. The surgery lasted 6 hours. 6 hours of meticulous work, opening the chest, harvesting vessels, grafting new blood supply around the blockages. Elle stood across the table from Reynolds, watching, learning, ready. At hour 4 it happened. The monitor shrieked. The general's heart went from normal rhythm to chaos. Ventricular fibrillation. V-fib, Reynolds announced. Internal paddles, 20 joules. The anesthesiologist charged the paddles, handed them to Reynolds. Clear. The shock delivered. The general's body jerked. The monitor showed the same deadly rhythm. Again, 20 joules. Shock, no change. 30 joules. Shock, still fibrillating. Reynolds looked at the clock. Amiodarone 300 milligrams. Prepare to start compressions. The medication went in. They waited. 10 seconds. 15. 20. The rhythm didn't change. "Starting compressions," Reynolds said. "Wait!" Elle's voice cut through the tension. Reynolds looked at her. "Dr. Kincaid, give me the paddles. You're not authorized." "I've done this before. Afghanistan, 2020. Marine colonel. Massive MI during a firefight. Coded 3 times. Internal cardiac massage for 17 minutes. He survived." Elle's eyes were locked on the general's face. "I refuse to give up on that Marine. I won't give up on this one." Reynolds hesitated. Then he handed her the paddles. Elle positioned them on the heart. Direct contact with the cardiac muscle. "Charging to 30 joules." The whine of the capacitor charging. "Clear." She delivered the shock. The heart muscle contracted violently. The monitor showed normal sinus rhythm. 1 beat, 2, 3. The rhythm held. "He's back," the anesthesiologist said. His voice carried disbelief. Reynolds stared at the monitor. "How did you?" "Because I've been here before." Elle handed back the paddles. "And I know Marines don't quit, not while someone's still fighting for them." The surgery continued. They completed all 3 grafts, closed the chest, moved the general to ICU. He survived. 10 days later, Elle sat in a hospital board meeting. Conference room on the administrative floor. Sterile. Corporate. The board members sat in judgment. Hospital administrators, senior physicians, legal counsel, all reviewing her case. Dr. Whitmore's lawyer presented the case against her. Reckless, dangerous, practicing beyond her scope. She performed emergency procedures without consulting senior physicians. "Both patients survived," Ashford interrupted, "with excellent outcomes. By luck, not by judgment. By skill," Ashford corrected. "By training, by experience." "She was a nurse 6 months ago," the lawyer's voice cracked. "She has no business making these calls." The board chairman looked at Elle. "Dr. Kincaid, do you have anything to say?" Elle opened her mouth. The conference room doors slammed open. General Marcus Brennan walked in. He was in a hospital gown, an IV pole in his hand, his chest bandaged beneath the thin fabric, but he stood at attention. "What is the meaning of this?" The chairman stood. "Sir, you're a patient." "I need to speak." Brennan's voice was weak but commanding. "About Dr. Eleanor Kincaid." The room fell silent. Brennan walked to the front. Each step cost him, but he didn't stop. He positioned himself directly in front of the board. "My name is Major General Marcus Brennan, United States Marine Corps, retired. I've served this country for 42 years. I've commanded Marines in combat. I know what courage looks like. I know what competence looks like. And I know what exceptional ability looks like." He turned to Elle. "This woman possesses all 3. "General Brennan," the chairman said, "with all due respect, you will hear what I have to say. Not a request, an order." The chairman sat. "I owe my life to Commander Thomas Kincaid. Fallujah, 2014. He ran into a burning kill zone, not once but 4 times, to save Marines he'd never met. I was the first. 3 others followed. He died on that 4th trip, saving the last man. That's the kind of warrior her father was, ago. His daughter walked into my hospital, ago. His daughter walked into my hospital room. Dr. Eleanor Kincaid. I told her who I was, what her father did, and she said 4 words, 'Let me save you.'" He turned back to the board. "7 days ago, I died on your operating table. My heart stopped. Dr. Kincaid brought me back. She refused to quit. For 9 minutes, while the surgeon prepared to call time of death, she kept working. She put her hands directly on my heart and willed it to keep beating." He pulled out a folder, dropped it on the conference table. "This is Dr. Kincaid's military record. 213 documented saves, 6 years of forward surgical team experience, Navy Commendation Medal with Combat V, Bronze Star for valor under fire. Recommendation for the Navy Cross, still pending approval. He opened the folder, started pulling out papers. Letters from 47 service members she saved. Recommendation letters from 5 SEAL team commanders. A letter from the Commandant of the Marine Corps, personally thanking her for her service. He turned to the lawyer. You call her inexperienced? She has more real-world trauma experience than every surgeon in this hospital combined. You call her reckless? She's calculated, precise, decisive. Because in combat, hesitation kills. His voice rose. You call her dangerous? She's the opposite. She's excellence personified. He looked at Elle. You're worried because she was a nurse 6 months ago? That means she has the medical knowledge and the practical experience. That's superior preparation. He picked up another piece of paper. This is a letter I wrote yesterday to the Secretary of Defense, recommending Dr. Eleanor Kincaid for the Presidential Citizens Medal, for her service to this nation, for being exactly what military medicine should produce, a warrior who happens to wear scrubs. He pulled something from his pocket, unwrapped it carefully, a gold pin, shaped like an eagle with an anchor, trident, and flintlock pistol, a SEAL trident. This belonged to Commander Thomas Kincaid. I've kept it for 10 years. His personal effects. I always meant to return it to his family, but I couldn't find them. He walked to Elle, held it out. This is yours. You've earned it. Not because you're his daughter, but because you're the same kind of warrior he was. He pinned it on her white coat, right next to her name tag. Then he stepped back, stood at attention, saluted her. Elle's vision blurred. She stood, returned the salute, sharp, precise, respectful. Brennan lowered his hand, turned to the board. Dr. Eleanor Kincaid is not a rookie. She's not inexperienced. She is not dangerous. His voice rang with conviction. She is exceptional. And if you can't see that, then you're all blind. He walked out. IV pole clicking. Each step painful but purposeful. The conference room was silent. The chairman cleared his throat. Dr. Whitmore's complaint is dismissed. Dr. Kincaid's privileges are fully restored. This meeting is adjourned. Ashford stayed behind. He walked to her, looked at the SEAL trident pinned to her coat. You've earned this, he said quietly. Not through politics or connections, through undeniable competence. That's the only currency that matters. Elle touched the trident. The metal was warm from Brennan's hand. I don't know what to say. You don't need to say anything. Your work speaks for itself. Elle stood alone in the conference room. The afternoon sun streamed through the windows. She looked at her reflection in the window. White coat, stethoscope, SEAL trident, doctor and warrior, both. Thank you, Dad, she whispered, for teaching me, for believing in me, for showing me what it means to never give up. The trident gleamed on her coat. A promise, a legacy. 2 weeks after the board meeting, Elle stood in the ambulance bay, watching a stunning Colorado sunset. November in Denver meant early darkness and cold that bit through scrubs. Dr. Kincaid? Elle turned. A young woman stood behind her, mid-20s, nervous energy, wearing fresh scrubs. Yes? I'm Dr. Thea Winslow. First day, I was told to report to you. Elle studied her, saw the same uncertainty she'd felt weeks ago. Military? Thea straightened slightly. Yes, ma'am. Army combat medic. 2 deployments. Afghanistan, 2020 to 2022. Enlisted first, then medical school? Yes, ma'am. Just like you. Thea hesitated. What you did for General Brennan, that's already being taught in tactical medicine courses. Elle felt the weight of expectations settle on her shoulders. First rule, Dr. Winslow, don't call me ma'am. We're colleagues now. Yes, Dr. Kincaid. Second rule, everything you learned in combat applies here. Every instinct, every lesson. Don't let anyone tell you that military medicine is less than civilian medicine. Thea's expression shifted. Relief. Validation. The overhead speakers crackled. Mass casualty alert. Mass casualty alert. Multiple trauma patients inbound. All available personnel to the emergency department. Elle and Thea moved simultaneously. Combat reflexes. No hesitation. They ran. The ER was controlled chaos. Nurses pulling equipment. Residents scrambling. Dr. Ashford appeared, already in a trauma gown. "What do we have?" he demanded. The charge nurse checked her computer. "Explosion at the Veterans Day ceremony downtown. Parking structure collapse. Initial reports say 40 to 50 casualties." Elle's blood went cold. Veterans Day ceremony. Veterans. Families. Someone had attacked them. "How many ambulances inbound?" "All of them. ETA 4 minutes. Ashford looked at Elle. Something passed between them. Understanding. Recognition. She'd trained for this. "Dr. Kincaid, you have command of the trauma response. Organize triage. Assign patients to teams." "Sir, you're the most qualified person in this hospital for mass casualty management. Take command." Elle's mind shifted gears. Combat mode. Operational thinking. "Listen up." Her voice cut through the chaos. "This is a mass casualty event. We treat this like a combat situation. Speed over perfection. Save the most savable first. Triage tags. Red, yellow, green, black. No exceptions." She pointed to residents. "U4, Trauma Bay 1 through 4. Red tags only. Immediate life-threatening injuries. Stabilize and move them. Fast." She turned to another group. "U3, handle yellow tags. Serious injuries but not immediately life-threatening." She looked at Thea. "You're with me. We're triage. We sort everyone who comes through that door." Thea's face was pale but determined. "Yes, ma'am." The first ambulance arrived at exactly 4 minutes. The paramedics wheeled in a woman, mid-50s, covered in concrete dust and blood. Elle's hands moved automatically. Quick assessment. Airway intact. Breathing adequate. Pulse strong. Obvious arm fracture. Multiple lacerations. Yellow tag. Bay 7. The second patient, elderly man, unconscious. Depressed skull fracture. Pupils unequal. Breathing irregular. Severe traumatic brain injury. Likely unsurvivable. But she had to try. Red tag. Bay 1. Neurosurgery consult. Patient after patient. Wave after wave. Elle and Thea work like a machine. Assess. Tag. Direct. 30 seconds per patient maximum. A young Marine in dress blues. Left leg nearly severed at mid-thigh. Tourniquet applied but still bleeding. Red tag. Bay 2. Vascular surgery stat. An elderly woman. No visible injuries but crushing chest pain. Cardiac event triggered by stress. Red tag. Bay 3. Cardiology consult. A child, maybe 7 years old. Multiple lacerations. Frightened but stable. Yellow tag. Pediatrics. The casualties kept coming. 15, 20, 30. The ER filled beyond capacity. Elle's voice stayed calm, authoritative. She directed traffic like a combat commander because that's what she was. At 23 minutes, 3 critical patients coded simultaneously. Bay 1, the young Marine. Hemorrhagic shock. Bay 2, middle-aged veteran. Tension pneumothorax. Respiratory arrest. Bay 4, elderly man. Cardiac tamponade from blunt chest trauma. Elle froze. 1 second. 2. The impossible choice. She couldn't save all 3. This was the nightmare scenario. "Thea!" Elle's voice cracked like a whip. Bay 2, tension pneumothorax. Needle decompression. Second intercostal space. Mid-clavicular line. Now! Thea's eyes widened. "I've never..." "You did it in Afghanistan. You can do it here. Go." Thea ran. Elle sprinted to Bay 4. The cardiac tamponade. She grabbed the pericardiocentesis kit. She prepped the site, betadine, drape, needle in hand. She inserted it just below the xiphoid process, angled it toward the left shoulder, advanced slowly, felt the pop as she entered the pericardial space. Dark blood flowed back, 80 cubic centimeters, then another 40. The pressure releasing. The monitor showed improvement, blood pressure rising, heart rate normalizing. Elle ran to Bay 1, the young Marine. He was on the table, unconscious, bleeding from everywhere. The vascular surgeon was working frantically. "I can't get control. The femoral artery is shredded." "Let me." Elle scrubbed in. Her hands found the artery, clamped it. She traced the vessel proximally, found the tear. It wasn't in the femoral artery itself. It was in the profunda femoris, the deep branch. Repairable. 6-O-proline. "I'm doing a repair." The surgeon stared. "You can't repair that." "I've repaired worse. In the back of a moving vehicle, under fire." Elle's hands moved with absolute confidence, suturing the torn vessel. Tiny stitches, precise, perfect. The bleeding stopped. The Marine's blood pressure stabilized. Elle stepped back, looked at the clock. 47 minutes since the first patient arrived. Around her, controlled chaos was becoming controlled order. The hospital had absorbed the mass casualty event and survived. She walked back to the triage area. Thea stood there, hands shaking. "Did you do it?" Elle asked. Thea nodded. "The needle decompression. Just like you said, the patient is stable." "Good work." "I was terrified." "I know, but you did it anyway. That's what courage is." Dr. Ashford appeared, pulling off bloody gloves. He looked at Elle with something approaching awe. 42 casualties, 40 survived. 2 deceased on arrival, nothing we could have done. That's a 95.2% survival rate in a mass casualty event. Combat medicine, Elle finished quietly. It's what I was trained for. It's more than that. Ashford looked around the ER. You turned this hospital into a forward surgical team. For 2 hours, we operated like a combat unit because of you. There's someone here to see you, Ashford said. Came in with the casualties, but refused treatment until he spoke with you. Elle followed Ashford to a curtained bay, pulled it back. General Brennan sat on a gurney. His arm was bandaged. His face was cut and bruised, but he was alive, conscious, smiling. General, I was at the ceremony, speaking about duty and honor. He gestured to his injuries. Then someone decided to make a point with explosives. Elle's hands automatically assessed him, checked his pupils, his vital signs. You should be in a bed. I've been in beds long enough. He caught her hands. I wanted to thank you. Not for me this time, for them, for everyone you saved today. He reached into his pocket, pulled out a medal. Gold, blue ribbon with white stars, the Presidential Citizens Medal. I told you I wrote a letter. This came through faster than any military award I've ever seen. Because everyone who read about what you did in combat, in this hospital today, everyone agreed. You deserve this. He pinned it on her white coat, next to the seal trident. You're not just exceptional to the Marines you serve with, or the general you saved. You're exceptional to everyone who believes that medicine is about more than knowledge. It's about courage, about refusing to quit. Elle looked at the medal, Presidential Citizens Medal, one of the highest civilian honors. She thought about her father, the last words he'd said. Courage isn't fearless, it's being scared and doing it anyway. My father taught me that duty means never giving up, Elle said quietly, that every life matters, that you fight for them even when it's hopeless. He taught you well, Brennan stood, and now you're teaching others. That young resident, I saw her. She moved like a combat medic because you showed her how. She already knew, I just reminded her. That's what great leaders do. He headed for the door, paused. Your father saved my life. You saved it again, and today You saved 40 more. That's a legacy. He left. Elle stood in the empty bay. Outside, the hospital continued its work. She looked at her reflection in the darkened window. White coat, stethoscope, seal trident, presidential citizen's medal. The uniform of a warrior who'd chosen healing. 3 days after the ceremony, Elle received an official letter. Department of Defense letterhead, sealed with the secretary's signature. She opened it in her office, read it twice, then a third time. The Navy Cross recommendation, submitted 4 years ago, lost in bureaucratic limbo, had been approved. Not just approved, expedited. But that wasn't the surprising part. The citation had been amended. Her actions at Mercy General Hospital, the solo emergency surgery, saving General Brennan, commanding the mass casualty response, had been added to the original combat citation. The medal would be presented in a joint ceremony, military and civilian. Recognizing that her service hadn't ended when she left the Navy, Elle stared at the letter. Her father had been recommended for the Navy Cross posthumously. Now she would receive hers while alive. Same medal, same family, 20 years apart. The watch hadn't just continued, it had been passed down, father to daughter, warrior to warrior. She picked up her phone, called General Brennan. "I got the letter," she said when he answered. "I know." She could hear the smile in his voice. "I made some calls. Your father was recommended for that medal for saving my life. Now you're receiving it for saving my life and 40 others." The symmetry felt right. Elle's throat tightened. "Thank you." "Don't thank me. You earned it. Both the military citation and the civilian recognition. You're what your father would have been if he'd survived. A warrior who chose to heal." After she hung up, Elle sat quietly. The seal trident caught the afternoon light. Soon, the Navy Cross would join it. Not as decorations, as reminders of duty, of sacrifice, of the unbreakable line connecting her to her father. She stood, pinned the letter to her bulletin board, returned to work. There were lives to save. That's what Kincaid's did. 6 weeks after his surgery, Marcus Webb came to Elle's office for his final follow-up. He walked in on his own, no cane, no limp, just a young man who'd been given a second chance. "Doc," he extended his hand, "I wanted to say thank you. They told me you saved my life. Did surgery right there in the ER. Elle shook his hand. "You did the hard part. You survived. You fought. Because you gave me something to fight for." He pulled out a photo. Him in Army fatigues. Basic training graduation. "I enlisted. Army medic training. I figure someone saved my life. Maybe I should learn to save others." Elle looked at the photo, saw herself 10 years ago. Young, determined, ready to serve. "You're going to be great at it," she said quietly. After he left, Elle added his name to the list she kept. Not the list of saves, the list of reasons. Why she did this, why it mattered. Marcus Webb, 21 years old, saved, now saving others, the legacy spreading, one life at a time. 6 months later, Elle stood in the same conference room where she'd been judged. But this time, she was leading the meeting, teaching new residents, showing them how to think like combat medics. Dr. Thea Winslow sat in the front row, taking notes. She'd become Elle's protege. "The key to mass casualty management," Elle explained, "is accepting that you can't save everyone. Triage isn't about giving up on people. It's about maximizing lives saved." A resident raised his hand. "That sounds cold." "It's not cold. It's mathematics. It's ethics. It's the horrible calculus of war medicine." Elle's voice was firm. "If you spend an hour trying to save one person with a 5% chance, you might save that person, or you might not. But either way, 5 other people with 90% chances will die waiting for you. That's not acceptable." Another resident spoke up. "How do you live with those choices?" Elle was quiet for a moment. "You remember them, every single one. You carry their names, their faces. And you use that weight to make you better, faster, more decisive, so that next time, maybe you save one more person than you did last time. The residents were silent, understanding. But here's the thing about combat medicine, Elle continued. It makes you better at all medicine, because you learn to see what matters. You learn that hesitation kills and decisiveness saves lives. After the meeting, Elle returned to her office. Dr. Ashford was waiting. "I'm retiring," he said without preamble, "in 3 months, and I've recommended you as chief of trauma surgery." Elle sat down heavily. "Sir, I'm 26 years old, and you've revolutionized this department. Survival rates are up 18%. Patient satisfaction is up 23%. We've had 6 hospitals contact us asking to observe your protocols." He smiled. "You're not just a good doctor, Elle. You're a leader, a teacher, the kind of physician who changes how medicine is practiced." "I don't know if I'm ready." "You're ready," he stood. "Your father would be proud, not because you became a doctor, not because you saved a general or won a medal, but because you never stopped being what he taught you to be, a warrior who protects the vulnerable, a medic who refuses to quit." After he left, Elle sat alone. The afternoon sun streamed through her window. She could see the ambulance bay below, a new trauma rolling in. Her phone buzzed. A text from General Brennan. "Ceremony tomorrow at Fort Logan. Your father's headstone is being updated. Navy Cross approved. Posthumous. Thought you'd want to be there." Elle typed back, "I'll be there." She stood, walked to the window, looked at her reflection. White coat, stethoscope, seal trident, Presidential Citizen's Medal. But what she saw wasn't the medals. It was her father's eyes looking back. His smile, his quiet strength. "I did it, Dad," she whispered. "I finished what you started. I saved them. All of them. Just like you taught me." The next morning, Elle stood at Fort Logan National Cemetery in her Navy dress whites, the same uniform her father had worn. The ceremony was small, just family, a few SEALs from her father's old team, General Brennan in his Marine dress blues, a Navy chaplain. The chaplain spoke about duty, honor, sacrifice. Then General Brennan stepped forward. He stood at attention, rendered a salute to the headstone that now read, "Commander Thomas Kincaid, Navy SEAL, Navy Cross, Silver Star, Bronze Star with Valor, Purple Heart, died in service to his nation. I stand here because of Commander Kincaid, what he did that day in Fallujah, the courage it took to enter that inferno repeatedly. That wasn't just heroism, that was the definition of duty. 4 Marines breathing today because one SEAL refused to leave anyone behind." Brennan's voice broke. He steadied himself. He turned to Elle. "Your father's legacy isn't just the lives he saved. It's you, what you've become, what you continue to do. Every patient you save is him saving them. Every resident you teach is him teaching them. Every life you touch is his life touching them." He saluted her. "Thank you for finishing what he started, for carrying on his mission, for being the warrior he raised you to be." Elle returned the salute, tears streaming down her face, not from sadness, from pride, from completion. She knelt at the headstone, placed her hand on the cold marble. "They called me exceptional, Dad, but I'm not. You are. You always were. I'm just trying to be half the medic you were." She stood, stepped back, saluted her father's grave. "Mission accomplished, Commander. The watch continues. I've got it from here." The ceremony ended. The crowd dispersed. Elle stayed behind. General Brennan approached quietly. "What will you do now?" Elle looked at him, at the man her father had died saving, the man who'd fought for her when no one else would. "I'll do what he taught me. I'll save lives. I'll train the next generation. I'll refuse to quit." She smiled, a small, fierce smile. "I'll continue the legacy, not because I want recognition, but because that's what duty demands." Good, Brennan offered his hand. The world needs more warriors like you, like him. They shook. Two warriors, two generations, connected by sacrifice in service. Elle drove back to the hospital, changed into scrubs, pinned the seal trident to her white coat, walked into the ER. Doctor Thea Winslow was already there. Young, nervous, determined. Dr. Kincaid, we have a trauma coming in. MVA, critical patient. ETA, 3 minutes. Elle smiled. Let's save a life. They moved together. Teacher and student, veteran and rookie. Both warriors, both healers. The ambulance arrived. The patient rolled in. The monitor alarmed. The dance of emergency medicine began again. And Elle did what she'd been trained to do, what her father had taught her, what 6 years of combat and 8 months of civilian medicine had perfected. She refused to quit. She made the impossible possible. She saved a life. Because that's what exceptional physicians do. Not for recognition, not for medals, but because duty demands it. Because lives matter. Because someone has to stand in the gap between death and survival and refuse to let death win. Elle was that someone, just like her father had been, just like she'd taught Thea to be, just like the next generation would learn from them. The legacy continued, the mission endured, the watch never ended. They mocked the new trauma doctor, called her inexperienced, questioned her credentials, doubted her competence. Then a Marine general called her exceptional, and the world understood what Elle had always known. She wasn't a rookie. She wasn't a former nurse who'd gotten lucky. She was a combat medic who'd become a trauma surgeon, a warrior who'd chosen healing, a daughter who'd honored her father's legacy by living it every single day. She was Dr. Eleanor Kincaid, and she was just getting started.